All right, let's unpack this. Today, we're taking a deep dive into a specific but really important medical protocol. It's all about how doctors handle something called Amaurosis Fugax, and quickly.
Exactly. And we're basing this on the official Amaurosis Fugax Management Protocol, specifically the 2025 updated version. So this is the latest thinking.
Right. So first off, what is Amaurosis Fugax? If you suddenly lose vision in one eye, maybe it feels like a curtain coming down, and then poof, it lifts again after a bit. That's pretty much it, right? A sudden temporary vision loss, usually just one eye.
That's the classic description. And crucially, even though it's temporary, it's a huge red flag. This protocol, it's all about speed, rapid diagnosis, rapid management. The stakes are just incredibly high.
Hi, how you mean permanent vision loss?
Well, yes, preventing that is important, but even more critically, it's about cutting the risk of a future stroke. It's basically treated like a medical emergency for that reason.
Got it. Okay, so our mission today, walk through this 2025 protocol. What actually happens? What are the key steps when someone comes in with this?
Well, it kicks off with a clinical diagnosis. Often an eye specialist is involved, and they'll use tools like a fundoscopic assessment. That's where they, look right inside the back of your eye.
And once they suspect it, this protocol says things need to move fast, like immediately.
Absolutely. No waiting around. It mandates an immediate diagnostic workup, ideally, like the very same day if possible.
Wow. Okay, what tests are we talking about in that urgent workup?
Key things. First, vascular imaging. Usually that means a carotid duplex Doppler ultrasound. Think of it like a special sound wave scan, checking blood flow in those big neck arteries, the carotids, looking for narrowing or blockages.
Makes sense. And the heart, I imagine that's involved.
Right away. A 12-lead electrocardiogram and ECG is mandatory. That checks the heart's electrical rhythm, looking for things like atrial fibrillation, an irregular heartbeat that could send clots up towards the eye or brain.
Okay. Neck arteries, heart rhythm, anything else?
Yeah, for patients over 50, there are specific blood tests required looking for inflammatory markers, things called ESR and CRP.
Why those?
They help screen for something called giant cell arteritis. That's an inflammation of blood vessels, another really urgent cause of vision loss that needs different treatment. So you got to rule that out or in quickly.
The protocol also mentions using a risk score, like ABCD2.
Yes, exactly. It helps gauge the immediate stroke risk based on factors like age, blood pressure, clinical features, duration of symptoms, that sort of thing. It helps decide how aggressive the next steps need to be.
So a lot happens very quickly. What really seems central is that carotid ultrasound you mentioned earlier.
It is, because the results from that scan heavily influence the next management steps.
Okay, walk me through that. Say the ultrasound shows significant narrowing in those neck arteries.
Right. If it shows severe stenosis, that means narrowing of 70% or more on the same side as the vision loss, then surgery, carotid endarterectomy, is strongly considered.
That's the procedure to actually clean out the plaque buildup.
Precisely. But, and this is key, optimal medical therapy, or OMT, starts immediately too, even while surgery is being considered.
Okay, what if the narrowing is like moderate, say 50 to 69%?
Good question. Surgery might still be on the table, but it's a much more individualized call that depends on the specific patient. But again, OMT starts right away no matter what.
And less than 50% narrowing.
Below 50%, surgery isn't usually the first move. The focus shifts squarely onto that optimal medical therapy and really digging deeper for other causes, maybe those heart issues or giant cell arteritis we talked about.
You've said optimal medical therapy, OMT, a few times now. What exactly is that in this context? Seems crucial.
It absolutely is. It's really the foundation for pretty much every patient under this protocol. It's a combination of specific medications and lifestyle changes, all aimed at lowering the risk of another event, like a stroke.
And the source, the 2025 update, highlights some specific changes here, right?
Yes, definitely. There's a really strong emphasis now on starting with dual antiplatelet therapy.
Meaning 2 drugs instead of 1.
Exactly, like aspirin plus clopidogrel, taken together, but only for a short period, typically 21 days, maybe up to 90.
Why the 2 drugs just for a short time?
The latest evidence suggests this combo is better at preventing another stroke or related event very early on, right after the initial symptom. Then, after that short phase, the patient usually switches back to just one antiplatelet drug for the long term.
Interesting. Okay, 2 drugs then. 1, what about cholesterol? That's always part of vascular risk, isn't it?
Absolutely. And another clear update is the push for high-intensity statin therapy. The protocol names specific drugs like atorvastatin or rosuvastatin. The goal is aggressive lowering of LDL, the bad cholesterol, This helps stabilize any plaque in the arteries.
So aggressive cholesterol lowering, the specific antiplatelet plan, anything else in OMT?
Yes, tight blood pressure control is vital. And lifestyle stuff, stopping smoking is huge, of course. It's a package deal.
So we have the rapid diagnosis, the tests, the management decisions based on the carotid scan, and this updated OMT. What else does the protocol stress?
Collaboration. A multidisciplinary team approach is critical, getting other specialists involved fast.
What?
Neurologist, for sure, especially if symptoms recur or the diagnosis isn't perfectly clear. And cardiologists, obviously, if the ECG is abnormal or there's any hint of a heart issue.
And it sounds like the protocol even gets into the nitty-gritty, like needing coordination and ensuring those ultrasounds happen same day. The urgency is baked right in.
Exactly right. It's very systematic from step A to step Z, diagnosis through follow-up, aiming for a smooth, super rapid process.
Okay, so let's try and pull this together. The heart of this 2025 Amaurosis Fugax protocol is really a rapid response system. Starts with the diagnosis, triggers immediate specific tests, neck scans, heart checks, then guides treatment based heavily on those scan results, especially carotid narrowing, and underpins everything with this crucial, updated, optimal medical therapy and teamwork between specialists.
That's a great summary. The speed and the thoroughness are the absolute key takeaways. It's all geared towards protecting vision, yes, but fundamentally it's about preventing that potentially devastating stroke that this temporary symptom might be warning about.
And those specific OMT updates, that initial short burst of dual antiplatelet therapy, the high-intensity statins, those are really important refinements in this latest guidance.
They really are. It reflects the ongoing learning about how best to manage this risk immediately after the event.
It's kind of amazing, isn't it, how a symptom that might literally last only minutes can trigger such a massive, coordinated, urgent medical mobilization involving so many different parts of the body and different specialists.
It really underscores the body's interconnectedness.
Yeah. Makes you think, what does this tell us about how a tiny, fleeting signal in one place, like the eye, can flag a critical, life-threatening risk somewhere else entirely, demanding such a fast, complex response? Definitely something to ponder as you think about staying informed about your own health.